How should young Agarwal couples approach genetic testing for SCA12?
One good thing about SCA12 is autosomal dominant, right? So, and what we call is penetrance. Once gene is abnormal, almost all the patient will have symptom in some part of life. So, if a family comes to me that my father has history, I see the family history of both the families, means the girl and boy. If girls or family also carries such gene, if boys family also carries such gene, then chances more. Of course, both will might have gene. So if they ask that whether we should go for child bearing for child or not, I can tell you that as a doctor, it's very difficult to say yes or no in this condition. In those conditions where uh, death is young, or on those conditions where disability is quite young, it's easy to tell. In this condition where disability is late onset and it's not that disabling, then I give all the fact on the table and then I ask them or help them to decide. First of all, uh, if young family doesn't have symptom, it's possible that both are SCA12 free, because as we know, that's only 50% chance of getting SCA12 from the parents. So who knows that this gentleman or the girl, none has SCA12. So if they are really keen to know that what to do for the childbearing, then I suggest that if you really want to go for that, you can go for a gene test of both of you, so you know what is your status. If after proper counseling they agree to it, if both are negative, that's fine, nothing to be done. If somebody is positive, then you have 50% chance of giving that to the children. Still, that doesn't mean that you should not go for a child, because we keep all the fact that you have gene positive, you might have symptoms in late age of life, your child might have another 50% chance of having symptom. But as this is late onset disease, if you take that risk that okay, if this will happen, still I'll go for the child, they can go. It's not that that is precluded. But my job is just to put the facts that you might have or your child might have 50% chance of having symptoms in due course of time. If you want to go for that, you can go. Now, regarding not having child or aborting the kid, this is beyond. Nothing is clear in India, as we know. So I don't give clear indication that what you do. I keep the things on the table and they decide about this. Yeah, the guideline what I can offer is as per my experience. There's no written guideline per se for such conditions, as you know. So first of all, if the patient comes to me and the patient already has child, say small child, and they have father who has a SA12, I don't I don't encourage testing, because they already have child. So what to be done right now? But if
Yeah.
somebody is planning pregnancy and if somebody really want to know what is my status, then I send the patient to my genetic counselor. I suggest they can go for that after thinking properly. So I would say that yes, they can go for that. But before that, even I counsel them that if it comes negative, you are happy. If it comes positive, don't worry at all. I'm there, and disease will come very late. So still, you can live a good life. And once I see that they can accept properly, then we send for the testing.